Good afternoon. My name is Dr. Michael Swarner, and even though you usually see my physician's assistant, Cheryl, I wanted to talk to you today. I'm glad to see that you are both here to discuss information about type 2 diabetes and how this will impact and change your life. The diagnosis is from Tina, but it will affect the entire family, and she will need the family support to conquer this disease. This may be a scary diagnosis, especially for someone as young as you. One of the first things you will need to do is choose a blood glucose monitor. You will need a blood glucose meter to measure and display the amount of sugar in your blood. There are many things that will affect your blood glucose levels. Exercise, food, medications, and stress are some of these factors. Using a blood glucose monitor can help you better manage your diabetes by tracking any fluctuations in your blood glucose level. Choosing the right meter. When selecting a blood glucose meter, it can help to know the basics of how they work. To use the most blood glucose meters, you first insert a test strip into the device. Then you poke a clean fingertip with a special needle to get a drop of the blood. You carefully touch the test strip to the blood and wait for the blood glucose reading to appear on the screen. When used and stored properly, blood glucose meters are generally accurate in how they measure glucose. They differ in the type and number of features they offer. Here are some of the factors to consider when choosing a blood glucose meter. Insurance coverage. Check with your insurance provider for coverage details. Some insurance providers limit coverage to specific models or limit the total number of test strips allowed. Cost. Meters vary in price. Be sure to factor in the cost of test strips. Ease of use and maintenance. Some meters are easier to use than others. Ask yourself, are both the meter and test strips comfortable and easy to hold? Can you easily see the numbers on the screen? How easy is it to get blood onto the strips? How big of a drop of blood is required? Special features. Ask about the features to see what meets your specific needs. Special features may include large, easy to handle buttons and test strips, illuminated screens, and audio, which may be useful for people with impaired vision. This specific feature probably won't apply for you. Information, storage, and retrieval. How does the meter store and retrieve your information? Some can track everything you'd normally write in a log, such as the time and date of test, the result, and trends over time. Some meters offer the ability to share your readings in real time with your doctor with a smartphone app. Some may offer the option to download your blood glucose readings to a computer or cell phone, then email the test results to your doctor. Support. Many meter manufacturers include a toll-free number that you can call for help. Look for a meter that includes clear instructions that demonstrate the correct way to use the meter. Some manufacturers offer user manuals for their websites. I have a couple examples of blood glucose meters with the different variations of features they include, such as the blood strips and the large number readings on the screen. How to use a meter. Once you have your meter, you will need to know how to use it, or get used to using it more like it. How to recognize low blood sugar levels. From the mildest, the more common indicators to the most severe signs and symptoms of low blood sugar include feeling shaky, being nervous or anxious, sweating, chills, and clamminess, irritability or impatience, confusion, fast heartbeat, feeling lightheaded or dizzy, and even hunger. to use your glucose meters and the testing routine, which are mandatory. Step 1 would be washing your hands with warm soapy water and dry well. If you use an alcohol swab, make sure the area is dry before testing. Prepare a clean needle for insertion into the lancet device. Remove a test strip from your box of strips and make sure to close the box. Stick the side of your fingertip with the lancet. Make sure the drop of blood is enough for an accurate reading. Do not touch the strip, just let the blood drop on it. Stop bleeding by applying pressure on the fingertip with a clean cotton ball or gauze. And I've gathered a couple examples of the lancing devices with the features that they may include and how to insert them with a smartphone. And here's an example of a kit of a lancet device with the clear readings of the numbers on the screen. How to self-administer insulin shots. The insulin needs to go into the fat layer under the skin. Pinch the skin and put the needle in at 45-degree angle. If your skin tissues are thicker, you may be able to inject straight up and down at a 90-degree angle. Push the needle all the way into the skin. Leave the syringe in place for 5 seconds after injecting. And here are some examples of where to put the syringe in, the different types of fatty layers on the skin, and what will be most easy and comfortable for you. Now I will try to answer some of the most common questions. Hopefully that will cover all your questions and maybe a few you haven't thought of, but if sure to ask me anything. One of the most common questions is, can a teenager be diagnosed with type 2 diabetes? Type 2 diabetes diagnosis for a teenager can be extremely rare. Type 2 diabetes used to be called adult onset diabetes. Type 2 diabetes is becoming more common in teenagers due partially to more obesity, but it's still pretty rare. There are steps to take to help manage your diabetes and lead to a healthy life. Adolescent type 2 diabetes. Diabetes is one of the most common chronic diseases among children in the United States. Type 2 diabetes has been reported among U.S. children and adolescents with increasing frequency. The increase in diabetes is due to more children and adolescents in the United States being inactive and becoming overweight or obese. Parents should know that any child or teen dealing with diabetes may experience emotional and behavioral changes, sometimes leading to depression. What should a newly diagnosed diabetic eat? For a healthy diet, eat a variety of foods, including vegetables, whole grains, fruit, non-fat dairies, healthy fats, and lean meats or meat substitutes. Try not to eat too much food. Try not to eat too much of one type of food. Space your meals evenly throughout the day and avoid skipping meals. How does type 2 diabetes progress over time? Type 2 diabetes is a progressive condition and usually gets worse over time. Making lifestyle changes such as adjusting your diet and doing more exercise can help. This will help control your blood glucose levels at first, but may not be enough in long term. What happens if you don't treat type 2 diabetes? If type 2 diabetes goes untreated, the high blood sugar can affect various cells and organs in the body. With type 2 diabetes, the body does not make or use insulin very well. Complications include kidney damage, often leading to dialysis, eye damage, which could result in blindness, or an increased risk for heart disease or a stroke. Is there any way to reverse type 2 diabetes or be cured? Although there is no cure for type 2 diabetes, studies show it is possible for some people to reverse it. Through diet changes and weight loss, you may be able to reach and hold normal blood sugar levels without medication. This does not mean you're cured. Type 2 diabetes is an ongoing disease. One of the things that people really want to know is what the life expectancy of a person with type 2 diabetes is. Type 2 diabetes is a serious condition that can lead to life-threatening complications, and on average, people with this diagnosis can have a shorter life expectancy by about 10 years. That being said, if you follow the guidelines for healthy living and other strategies we will go over, you can be one of the many people with type 2 diabetes that can expect to live as long as a person without the condition. Another common question for patients or parents is how do you know if a teenager has diabetes? Some of the most common symptoms of type 1 diabetes among children and adolescents include increased thirst and urination, hunger, weight loss, fatigue, irritability, fruity smell on the breath, or even blurred vision.